Access to personal protective equipment, to PPE, has been top of mind for us at Bozeman Health from the very beginning. It's clearly top of mind for members across our community who are wanting to make sure that we're ready. And so while we are feeling confident about what we have in place and proud of the steps that we've taken forward in ensuring an effective supply chain for the future, we're also watching what's happening around the world and around this country, and we are concerned.
We ordered in our normal practices, and then all of a sudden it became a reality of like, those things are not going to be available and we will run out. And to have that weight to propel us to find alternate ways was scary.
We got some very early communication from our manufacturing partners in Asia that this was happening and that they were anticipating disruptions. We haven't had the opportunity to continue to bring in our workers because of that shutdown.
With Sims, they were friends with many of the people that we work with every day here at Bozeman Health. And I reached out and contacted them, and they were more than willing and excited to help out.
I contacted friends over at Sims and had actually learned that Bozeman Health and Sims were already in contact about the possibility of creating washable, reusable gowns. So that was good news.
And so it really was a few of us kind of coming together on this idea right about the same time, and working with Bozeman Health to figure out how we could align our capabilities with your needs. This is uncharted territory for all of us. It's been a really fun process to just kind of figure out how we can take what we're really, really great at and harness them to produce protective equipment for medical professionals.
They had to create something that Sims had never manufactured before. And that Bozeman Health specifications were very, very precise. There's FDA specifications and other things. So they had to work very quickly in order to get a working prototype.
Commissioner Terry Cunningham, who has strong relationships both with Bozeman Health and with the leadership team at Sims, helped shepherd this project forward, even transporting sample gowns from Bozeman Health out to Sims, prototypes that Sims had worked on back to us. And he helped to navigate important donor partnerships as well.
When he called to say that there was a possible partnership opportunity with Arthur Blank and with Bozeman Health and with Sims to create surgical gowns, we just thought this is a no-brainer. We're in a battle and we need to protect our nurses and doctors the way soldiers have been protected in the past, and that's the way we've approached this.
While Sims is going to pay its sewers to produce this product, we are then utilizing donor support that we've realized from Yellowstone Club Community Foundation and the AMB West Foundations to cover the very basic costs that Sims is incurring.
When we reached out to some of our employees to ask if they could come back to help us with this, you know, nobody asked any questions.
We discussed back and forth what options were going to be best and what they could actually make in their facility, and were able to create a gown that's really going to be, in my opinion, better than what we have ever had as far as from a medical facility that produces medical grade gowns.
To have watched our community rally in the way that it has, to watch our donors lean in behind us and help us do this work, has been a real point of pride for us. We live in a special place. We're going to get through this together. It's going to take an army of us to make it possible, and that army's coming together.
I've never been more proud of our community. We have each other's back. We rise to the occasion. There's not a challenge that we can't meet, and this is an example of exactly that. Community partners working together in order to create something that they've never done before.
People are incredibly inspired and motivated to be working on this. It's been really a gratifying project for all of us.
This is something that will not only help our staff, our patients, our entire facility. It's going to keep our own families safe. It's going to last a very long time beyond the physical measures of what people have done. It's really created bonding relationships across the community in ways that I just could never imagine.